Somatic symptom disorder is characterized by an extreme focus on physical symptoms, such as pain or fatigue, that cause major emotional distress and problems functioning. You may or may not have another diagnosed medical condition associated with these symptoms, but your reaction to the symptoms is not normal. You often think the worst about your symptoms and frequently seek medical care, continuing to search for an explanation even when other serious conditions have been excluded. Health concerns may become such a central focus of your life that it's hard to function, sometimes leading to disability. If you have somatic symptom disorder, you may experience significant emotional and physical distress. Treatment can help ease symptoms, help you cope, and improve your quality of life. Welcome to this health channel. Watch the full video to learn more about somatic symptom disorder. Somatic symptom disorder in adults. Somatic symptom disorder happens when a person feels significantly distressed about physical symptoms and has abnormal feelings and behaviors in response to them. These responses interfere with their daily functioning. The physical symptoms may be due to a medical condition or have no clear cause. What is somatic symptom disorder? Somatic symptom disorder is a mental health condition in which a person feels significantly distressed about physical symptoms and has abnormal thoughts, feelings, and behaviors in response to them. The disorder disrupts their daily functioning and quality of life. Although a person with somatic symptom disorder reports symptoms, the symptoms may have no medical explanation or be normal body sensations or discomfort. Even when there's a medical cause, the person's worry is out of proportion to the symptom. People with somatic symptom disorder are often unaware of their underlying mental health condition and believe that they have serious physical ailments. The distress often causes them to visit multiple healthcare providers and to have many medical tests and unnecessary procedures. What's the difference between somatic symptom disorder and illness anxiety disorder? Illness anxiety disorder is a mental health condition in which a person is preoccupied and excessively worried about having an illness or getting an illness. Unlike somatic symptom disorder, a person with illness anxiety disorder usually doesn't experience physical symptoms. What's the difference between conversion disorder and somatic symptom disorder? Conversion disorder is a condition involving the function of your nervous system with no evidence of physical or neurological causes. This can cause symptoms that affect your perception, sensation, or mobility. While people with conversion disorder frequently experience depression or anxiety, excessive worrying and distress about the physical symptoms aren't part of the diagnosis for conversion disorder. In contrast, excessive concern about physical symptoms is the main part of the diagnosis of somatic symptom disorder. Who does somatic symptom disorder affect? Somatic symptom disorder can occur in children, adolescents, and adults, and it usually begins by age 30. People assigned female at birth are 10 times more likely to have somatic symptom disorder than people assigned male at birth. How common is somatic symptom disorder? Somatic symptom disorder is somewhat common and occurs in about 5% to 7% of the adult population. What are the signs and symptoms of somatic symptom disorder? Physical symptoms that people with SSD may have include 1. Pain, 2. Fatigue or weakness, 3. Shortness of breath. The physical symptoms may be mild to severe, and there may be one or multiple symptoms. They may be due to a medical condition or have no clear cause. How people think, feel, and behave in response to these physical symptoms are the main signs of somatic symptom disorder. People with SSD may 1. Feel extreme anxiety about their physical symptoms. 2. Feel concerned that mild physical symptoms are signs of serious conditions. 3. See their healthcare provider for multiple diagnostic tests and exams but do not believe the results. 4. Feel that their healthcare provider doesn't take their physical symptoms seriously enough. 5. Go from one healthcare provider to another or seek treatment from multiple providers at once. 6. Spend excessive amounts of time and energy dealing with health concerns. 7. Frequently seem unusually sensitive to drug side effects. 8. Become dependent on others, demanding help and emotional support, and become angry when they feel their needs aren't met. 8. Have trouble functioning day to day because of thoughts, feelings, and behaviors about their physical symptoms. Approximately 30% to 60% of people with somatic symptom disorder also have anxiety and/or depression. What causes somatic symptom disorder? Researchers believe there are many biological, environmental, and psychological factors that can contribute to the development of SSD, including 1. Childhood physical and sexual abuse. 2. Poor awareness of emotions or emotional development during childhood. This can be the result of parental neglect or a lack of emotional closeness. 3. Excessive anxiety and attention to bodily processes and possible signs of illness. How is somatic symptom disorder diagnosed? Your healthcare provider will perform a physical exam and probably order some laboratory tests to rule out conditions that may be causing your physical symptoms. They'll also ask you about your health history. If test results show that you don't have a medical condition or illness, or that your medical condition doesn't match the severity of your symptoms, your healthcare provider may refer you to a mental health provider for assessment. A mental health provider, such as a psychologist or psychiatrist, confirms a diagnosis of somatic symptom disorder using specific criteria. To be diagnosed, a person must have one or more symptoms that cause distress or disrupt daily life for at least 6 months. How is somatic symptom disorder treated? The goal of treating somatic symptom disorder is to manage physical symptoms, as well as psychological symptoms using psychotherapy and sometimes medications that treat underlying anxiety and depression. Cognitive behavioral therapy is a type of psychotherapy that helps people learn ways to change their patterns of thinking or behavior in order to change the way they feel. Under the guidance of a psychologist or psychiatrist, CBT helps people better cope with anxiety and stress and respond to situations more effectively. What are the features of somatic symptom disorder? People with somatic symptom disorder, thought of as hypochondriacs, are worried about having a physical illness. The symptoms they describe can range from general complaints, such as pain or tiredness, to concerns about normal body functions, such as breathing or stomach noises. People with somatic symptom disorder are not faking or lying about their symptoms. They truly believe they are sick. Or, if they do have an actual physical illness, their level of worry and distress is out of proportion to the condition. Subscribe to our channel to keep up with new content. Your subscription, support, and feedback are much appreciated.